The top spine health mistakes that are keeping you in pain. Namaste. You are watching another straight talking session on spine health. I am Dr. Vardhan, your host and your dost, and India's leading Ayurveda spine specialist. Today's episode is a little different from all other episodes. Why? Well, this episode is all about the mistakes, the daily habits, the mindsets, and the routines that quietly damage your spine. You may be treating pain, taking medicines, maybe even doing yoga, but pain still remains and returns. Why? Because you may be repeating one or more of the biggest spine health mistakes. Let's break them down one by one. You know what? I tell all my patients, pain is not weakness, it's a signal. Your body is talking to you, but are you listening? That nagging lower back ache at the end of the day, the stiffness in your neck every morning, the slight tingling in your foot that goes away after walking. These aren't random, they are warnings, but most of us ignore them. We push through, we take painkillers, we even adjust our lives around the pain instead of adjusting the problem. Early stage disc bulges can be reversed. Nerve pressure can be reduced. Postural corrections are easy when the spine is still responsive. But if you wait too long, that small signal becomes a chronic issue. The earlier you address pain, the faster and cheaper the healing. So, the first mistake is ignoring all those early signs. You have heard it. Just do some stretches, start yoga, strengthen your core. Exercise is important, but here is the truth. If your spine is inflamed, unstable, or stuck in spasm, no amount of movement will fix it until you calm it first. Too many people jump into random back workouts without addressing the underlying dysfunction. Result? The pain gets worse or shifts elsewhere. Ayurveda teaches us, first reduce your pain and inflammation, then support mobility, then build strength. So exercise is step 3, not step 1. And even then, it needs to be personalized. What works for someone with postural pain won't work for someone with nerve compression. You need the right movements in the right order and with the right foundation. Mistake number 3 is an interesting one. Sitting wrong all day long. Let's be real. We sit more than we move. Work, commute, eat, scroll, watch, and we rarely think about posture until it's too late. Most of us sit with a curved spine, forward head, shoulders hunched, and hips locked. This does 3 things. It compresses our lumbar discs, it weakens the core muscles over time, and strains our neck and upper back. Even the best chair can't fix bad sitting habits. Then what is the solution? Sit tall, back straight, feet flat, knees level up with your hips. Take breaks every 30 to 45 minutes. Walk, stretch, and realign yourself. Keep your screen at eye level. Fix your sitting and you will fix 50% of your daily stress on the spine. Now, before I delve into the 4th mistake, I'll ask you a question. What will you do when pain hits? Of course, most of us feel like lying down the bed. Rest for a few hours or until it eases. But then the pain comes back. Sounds familiar? Rest has a place, but not the way most people use it. Long-term bed rest weakens muscles, reduces the blood flow, and stiffens the joints. It may feel good short-term, but it delays healing altogether. Ayurveda believes in active rest. This means reducing aggravated movements but encouraging circulation. It means supportive therapies like Abhyanga, Vastikarma, Kati Vasti, not passive lying down for weeks. Movement when done right is medicine. Stillness when done wrong is decay. Now comes the fifth one. I have named it overrating pills and underrating root causes. When it comes to pills, there are plenty of options nowadays. Painkillers, muscle relaxants, and steroids. They bring relief, definitely, no doubt about it, but they don't bring correction. You feel better, but at the same time, the disc is still bulging. You sleep well, but the nerve is still compressed. You mask the signal, but the problem is already growing. Spine issues aren't chemical, they are mechanical and energetic. The disc is a structure, the joint is a structure, but the nerve is electrical. Ayurveda understands this. That's why we don't suppress symptoms. We correct the imbalance, reduce the inflammation, rebuild the tissue, and re-educate your posture. So, although medications have a role, they are support, not a solution. And now let me tell you the biggest mistake. And it is nothing but believing only one system works. Some say only surgery can fix this. Others say only yoga works, or Ayurveda is too slow, or modern medicine is too risky. Truth is, integrated healing works best. In my practice, we combine Ayurvedic therapies with yoga therapy and physiotherapy. We don't choose quick fixes, we choose results. Your spine doesn't care about medical politics. It cares only about support, nutrition, and alignment. Whether that comes from a Meru Chikitsa or a traction bed, that doesn't matter. So that's all for today. Now, when you know about the mistakes, I am sure that you will be able to fix them. Thank you for watching. If this has helped you reflect on your habits, pass it on. Someone else may be repeating the same mistakes. Subscribe to my channel for real talk, real insights, and real healing from Ayurveda. And hit that bell icon because pain doesn't wait. Stay safe, stay strong, and take care of your spine.